Uday, we can't hear you.
Can you hear me now?
Yes.
Panduram?
Yes, yes.
Okay. Okay. Can we start the program?
Yes.
Okay. Dr. Ajoy Prabhu and Dr. Jennifer Prabhu, can we start the program, please?
Yes, yes. I'm just trying to turn my video on. Hang on.
Okay, okay.
There you
Thank
go.
you so much. Thank you so much. So, on behalf of GSB Sabha Mumbai, I welcome Dr. Ajoy Prabhu, Dr. Jennifer Prabhu, and all of you who are here for the 6th edition of our Samvad series. So as usual, we begin this program by remembering God Almighty. We remember the Swamijis. We remember our ancestors and our elders to start the program. Today is also International Yoga Day. Today also happens to be Father's Day. So greetings to everybody on both these occasions also. Today for doing the 6th edition of the Samvad series, we have a doctor couple with us. So there are a few firsts here, I should say. This is the first time that we are having a couple doing Samvad with us. Also, this is the first time we are having somebody from beyond the borders. So Dr. Ajoy and Dr. Jennifer are presently in Puerto Rico in the US. And so whereas we are here in India at a comfortable time, evening time on a Sunday, so I think it's about 7 a.m. for them there, right, Dr. Prabhu? It's 7 a.m. for you there. So
Yes.
that's a pretty uncomfortable time on a Sunday morning for which we have requested you to speak to us. We really appreciate the fact that you are doing that for us. So today's topic is staying positive. This is a topic which is required at all points of time for all of us. But one particular event which happened last week especially highlighted the importance of staying positive for everybody. So this is really a very relevant topic which has come at this point of time for us. I would like to briefly introduce the speakers before we move to the second topic. So one interesting thing is that we come out with the Voice of GSB, our quarterly newsletter, every 3 months. So in the next issue, which is July to September issue, Dr. Veena Adige, and I think she is also part of our audience today. So Dr. Veena Adige is writing an article for us on Corona Warriors. And I'm very happy to tell all of you here that both Dr. Ajoy Prabhu and Dr. Jennifer Prabhu are featured in that article. So they are in the forefront of the fight which the entire world is having against this pandemic. And we really salute both of you doctors for being in this particular battle and leading from the front in this particular battle. Giving a brief introduction about both of them. So Dr. Ajoy Prabhu is a research scientist with a background in pathology and epidemiology. Recently, he was the head of marketing of patents and inventions at the US National Institute of Health. He also led White House efforts under President Obama to consolidate all federal research resources. He has authored numerous patents and research papers. Coming to Dr. Jennifer Prabhu, she has specialized in two areas simultaneously, internal medicine and pediatrics. She is a fellow of the American Academy of Pediatrics and a member of the American College of Physicians. She is licensed in clinical laboratory medicine and has been awarded for being an outstanding physician as well as a pediatrician. So thank you very much, Dr. Ajoy Prabhu, Dr. Jennifer Prabhu, for accepting our request and for doing this Samvad. So Samvad is actually a dialogue. So Samvad with us on the topic of staying positive. And now it's over to you. Thanks a lot.
Thank you so much for the kind introduction. We are really very grateful that you let us be on this forum because we feel that what GSB Sabha has been doing. We've been following it from US, of course, but what GSB Sabha has been doing is really noteworthy.
Thank you.
So again, thank you so much for allowing us to on this platform. In terms of us, you've been very kind about telling everybody about what we've done. We are desperately waiting to get to Mumbai now. We were supposed to be there on the 31st of March, but of course, entire India locked down before that. So we are now waiting to see when we'll be allowed to get back in there and really do the things that we want to do. We've been planning this for like 4 years now to finally get to India and start working there. In terms of this topic, because of this COVID pandemic, as well as because of the fact that, there has been a lot of, other uncertainties in our lives in recent times. And we are confined to an area, we feel that maybe it is, it kind of breeds negativity and maybe even tends towards depression. So we thought that maybe we should at least bring out some of the tools that we have learned over the years, in academics and in our own experience, to kind of like get away from the negativity and become more positive. Not only positive, we are hoping that some of the tools and tips and tricks that we would like to share will enable people to thrive in this environment, because you can use this as an opportunity to instead of looking at it as negative, think of it as an opportunity to grow yourself and become more positive about things. So in that regard, this is not just us saying this. Numerous studies in respective journals have shown that, for example, in cancer patients, you just make them feel better, make them feel positive, they feel positive, and their cancer gets resolved, or the clinical outcome from their disease, it gets better. So positivity it's not just some mumbo jumbo. It really works. So in this pandemic, if you are positive, and we have cases upon cases just about COVID itself, where we've constantly talked to people and said, do this, try to be positive, and they've all come out, we feel at least, come out of the disease faster than they would have if they were negative. So as far as our talk is concerned, we're trying to keep it very, very simple so that people can understand. And at the end of the talk, what we are doing is we'll give you all the resources that we're talking about. We'll put it up on our website. We will also make sure that, of course, GSB Sabha is recording this, so this will be available. Any tips and like tools, like apps or websites that we'll be talking about, we'll provide you with the links so that you can always refer to them later on. You can always go to our website and put it up, but all these will be available to you, because everybody needs a refresher. We also need a refresher. So I don't want to waste too much time, and let's just get into the actual talk itself. So what I would like to do is share my screen and begin the presentation, if that's okay. Share screen, and it is okay. Can everybody see this?
Yes, we can.
Okay. So there are 4 parts to this talk. We'll go from inside to outside. So we'll start with the spirituality part. Then we'll talk about emotion. We'll talk about mental attitude, and we will talk about the physical aspect. So we'll go from the inner to the outer. It's just a very systematic. That way we can keep it systematic and explain certain things to you. So as far as meditation is concerned, we understand that meditation may not be easy for some, and especially more difficult considering the current close proximity of other family members. But we feel that taking just 5 or 10 minutes a day can make a huge impact on improving your overall well-being. In our case, for example, we take turns. We just go into another room, in a quiet room, away from our sons and spouse. We put on headphones so we don't hear them, And in that moment, we can actually sit quietly in our own so-called me time and try to meditate as best as we can. We typically use a pre-recorded mobile app, and we'll share some of the apps that we've been using. We're not like really wedded to one particular app, but we've used like 2 or 3 types of apps, and we'll share the actual apps that we use. But it's really, really helpful to just kind of take time away from all the commotion that's happening inside your house and just be with yourself and your thoughts and meditate on something. So, if you're already familiar with meditation, maybe you should just, rejuvenate that, that idea of meditation. The next one is something that we don't really think about it as a positive, but it actually scientifically has been proven to help. Things like bhajan kirtan is very helpful in terms of I'm sorry, give me a second. So in terms of connecting with the divine, and there is a very good reason why we do this. Is that you are completely immersed in the singing, listening, and you ultimately forget your worries and stresses. It kind of like resets you. So it's not something that I know a lot of times we just do it, but we don't realize that what a powerful tool that is for us to use. Reading, similarly, reading holy books also is very immersive, quite engrossing, and you tend to get lost in the stories and the lessons that they impart. And the other benefit of that is you can not only imbibe those stories, but also as you're telling those stories to others, you kind of get you again don't think about your worries, etc., and you're actually lost in the tales or the lessons that that the books have that the books are providing you. Okay. Next is seva, doing something greater than yourself and giving without expectations. As they say, karmanne vadikaraste ma phaleshu kadachana. That's very apt here. So it's really helpful to do something that you don't have much control over. It may sound strange, everybody talks about having control, but when you do something that is greater than yourself, where you are not in control, fully in control, it actually makes you there are certain hormones that are triggered. Colloquially we would call them happy hormones, but they're like, if people want to know, like things like serotonin, oxytocin, dopamine. These hormones are released when you are actually doing something that is greater than yourself in terms of charity for others. So, I mean, a perfect example actually is this GSB Sabha talk itself. I mean, we're not gaining much out of it, but especially the volunteers that are doing this, there is a sense that pervades all this, that it's helpful for the community, so we should do it. And in return, they feel positive about it, and that's exactly where we are going with this. Let's move on to the emotional part here. Emotional part, listening to music is a good thing. For example, it's been repeatedly shown to be particularly therapeutic. There are a few famous cases. For example, you may have heard of the cows listening to music and producing more milk. Or recently there was some even ads by IKEA that said that when plants were were placed in places where there was music playing, they grew faster and had more flowers. So it's amazing that if it can affect cows and plants, I'm sure it definitely affects human beings. So what we typically do, and of course you can always listen to music with everybody around, but sometimes it's the reason why we put that little slide there with the lady with the headphones is just simple headphones can be very immersive. Even the tiny iPod headphones are fine. It can be very immersive Whether you are in the room with others or not, it does not matter as much. But I think, the immersive part and actually listening to the music kind of takes you away from your day-to-day worries, at least for that moment. And that's exactly what we are doing. Again and again, we're going back to the same thing, same theme of moving yourself away from the day-to-day worries just for some time, so that your body, mind, and soul can reset itself. Okay. You can write, with the old fashioned, like pen and paper, write a letter to your friend or write a journal. Our son has started doing something like, he just takes pieces of paper, staples it, and then writes something on a daily basis about, what kind of birds he saw and things like that. So, when he was doing that, that's when it occurred to us that, we remembered that that's also very therapeutic, to be able to just simply, write your thoughts down or write your feelings down, and just getting that out in the open is also a stress reliever. I think Jenny is going to talk more about that part shortly. This one is very important, to confide in somebody. Now, I'm sure you confide in your spouse, definitely, but we recommend that you try to have at least one or two other confidants that you can talk to and confide in, that most importantly don't judge you, don't immediately spit out answers saying, okay, this has happened, this, or start thinking about what is going on. Rather, just listen to you, and then if you say, can you give me advice, they give you advice. Those are the kind of confidants that you should try to cultivate. I'm sure you have some, and you just need to cultivate them a little bit more, so that you can always pick up the phone and talk to them. Again, multiple studies have shown that just the act of getting your concerns and worries out in the open relieves stress. So you don't even need to get an answer from the other person. Just saying it out aloud to that person will help you relieve the stress that has been built up. To top that, the feedback that you get from your confidant is an additional bonus. Sometimes just having somebody to quietly listen is enough to get, to make you feel positive about something. If all else fails, I have to say, you may want to call a doctor. And, we have to realize that at a certain point, we need a trained, physician who's trained in psychology, or a psychologist or a psychiatrist, to help here. So this is where, I'm not qualified in that area. My background is diseases and not mental diseases. But however, Jenny has, I think like roughly 40% or 50% of her patients are she's giving counseling, especially because we are away from the mainland. She's getting more and more of these calls where she has to do a lot of counseling. And they are trained to recognize when something is amiss, and some other additional interventions like behavioral psychotherapy is needed, or something like that is needed. So keep your doctor in mind, or somebody who is a professional in this area in mind, and talk to them. Jenny, I just wanted to let you know that as far as this, whatever audience is right now, she is available on DoxyMe, and you can always contact her, or you can even call our contact us on our WhatsApp number, which we will provide at the end of the talk. So, at this point, I'd like to hand over the floor to Jenny, and she'll take you through the rest of the basis.
Hi, everyone. So as Ajoy said, we're kind of moving through the proverbial brain here. So let's get on to the next topic, which is mental health. And being a pediatrician, I have to throw in some fun. So games. So games aren't just for fun, though. Of course, they are fun, but what they actually do is something physical in the brain. They're getting oxygen and blood moving to that area, so it starts working better, which has benefits for the whole body. I've been telling this to my patients as well as us trying to kind of do it ourselves at home. Now's the time that you have more time to start picking up things that you haven't looked at in years. Chess, which we've been doing almost daily and teaching our 7-year-old. Ludo, card games, Antakshari, charades. You can even be more creative and do a quiz contest with your family. So, it can be very social in that way, but you can also, if you're alone that day, you can do individual games like solitaire. Puzzles especially are particularly good, word puzzles and actual, putting together puzzle pieces. But if you can, it's even better to involve, like I said, friends and family, even if it's virtually. So we've actually had some kind of Zoom family game nights and friend game nights over the past couple months, since that's really the only way we can meet people at this point, but have been really good for us and hopefully our friends too. Okay. So hobbies also might seem kind of silly, but is, in clinical medicine actually very important. In fact, in the electronic medical record system that we use, I actually have a specific area for each patient that lists their hobbies. That's how important it is. And I know it's, listed in other EMRs too that my colleagues have used. So in fact, if a patient tells me they don't have any hobbies or any outside interests, that actually makes me a little concerned and is maybe a red flag that something else could be going on, like depression or anxiety. So hobbies are super important. From my training and when I used to be more in the hospital setting, a lot of times there are services for hospitalized patients that they can continue their hobbies while they're in the hospital to keep their spirits up. Like Ajoy mentioned, having a positive outlook and a positive spirit when you're ill can absolutely change and improve your outcomes. So that's why hobbies are so important. And why not take this time to pick up a new hobby if you already have one, or to improve upon a hobby that you have had for a while or haven't looked at for a while. So for instance, for me, I love baking. That's very therapeutic for me. So I've been practicing new methods of baking. We have friends and family that are working on their painting skills. I have some friends that are kind of working on their plants, working on their gardens, or if indoor plants if you can't get outside. Notice we're concentrating on more indoor hobbies at this point, since that's mostly what you can do now. But yeah, think of something. Hopefully this will give you some ideas, some inspiration. So finally moving literally on to the outermost quality, which is physical health. So appropriately, it is International Yoga Day today. And we all know that yoga has been shown throughout the world and in many studies to be beneficial for both mind and body. Stretching physically awakens your muscles, bones, ligaments in that moment. And then as you continue your yoga practice, it actually develops strength over time. So that's an additional benefit of continuing your practice, no matter how often you do it. Medical studies have shown that yoga actually improves chronic diseases. And I've again seen this in us as well as in our patients, but diabetes, high blood pressure, thyroid disease, osteoporosis, osteoarthritis, and various other things, but specific studies have shown the benefits of yoga. And I've actually noticed, again, bringing it back to us, when I've been doing yoga regularly, which we have been, thankfully, I actually crave to do more yoga when I'm maybe not having a good day. If I'm feeling a little down that day, I go and do some yoga and immediately feel invigorated again. So hopefully, others can benefit from that as well. And aerobic exercise. So just like yoga, does your muscles and helps your mind and helps your strength, aerobic exercise strengthens, I would say, more your inside organs, so your heart and your lungs, etc. And you don't have to be a marathon runner to reap the benefits of aerobic exercise. even doing something simple like getting yourself moving, walking around your living room for a couple minutes, which might be all that we can do these days, will give you long-term benefit. Or something as simple as pranayama will also help. That's going to absolutely exercise your lungs as well. On that note, we're actually going to be showing you a video in a couple minutes of some of the exercises that we do around the house during this time. And hopefully you can learn too and practice that as well. Again, going back to us, both Ajoy and I have been practicing one of our hobbies, which is jogging. So, you know, if we're having a spat between us or if the kids are driving us nuts, we'll take turns going out for a jog. And we both have noticed that we feel significantly better at the beginning of the jog, and even after, even when you're physically tired, you just feel so much better because things are moving, blood is getting to the right organs, et cetera. Another way to kind of tie in physical exercise to social and emotional health is to make it a social activity. So, you know, get a running buddy, get an exercise and stretching buddy, and you guys can make each other accountable for making sure you do at least some amount of exercise. Or if that's not possible, make it a group activity with online exercise videos, live exercise classes. We know a lot of family and friends that are doing those on a routine basis, and it really gives them something to look forward to. So now we're going to show you about a 3-minute clip of ourselves recording some of these exercises. Apologies for not perfect form. So Ajoy, you want to put those on?
Yeah, sure. So again, like Jenny said, what happened here? Abstract syndrome? What happened to the video? I'm sorry, give me a second. I'm not sure what's going on here. There it is. I'm not sure what happened here. Okay. Hopefully the audio will come through.
Most of these are yoga asanas, and at the end you will find that some of them
I hope the audio is there.
Vajrasana to Virasana. Settle onto your knees, rest for a minute, and then slowly spread your feet and sit on the floor. Parivratrasana in Sukhasana. This one is a wonderful way to move the fluid between your vertebrae so that the newly oxygenated fluid can get in there. Balasana to Bhujangasana. All day we carry on a slightly slumped manner or bent forward, especially with our smartphones in our hands. This one really nicely counterbalances it. Supta Matsyendasana. Again, another spinal twist, but with a little bit more intensity as your legs pull you onto one side and you look towards the other. Marjaranasana to Bithilasana. This one is great for sciatica pain, usually due to a pinched back nerve. Also open up the spine. Virabhadrasana 1 and 2. Slowly we are moving to open up our lungs, and this is the start. Tadasana to Adho Mukha Svanasana. This one helps open up the top part of our lungs as well as shoulder joints. Easy jumping jacks. Start slow with this one. There's no rush. Jumping jacks. If you can manage to move your arms above, it will help open up the lungs even more. Mountain climbers. Some of us find jumping jacks to not increase breathing enough. This one will certainly take care of that. Slow march in place. This starts to engage the largest muscles in your body, in your legs. Think of them as engines that will help burn more and more energy. Slow knee ups and arm circles. This will increase the intensity a little bit more. If you can, try and open up the knees to the sides. And start rotating your arms the way I'm showing you. Chair squats. Again, we are hitting the largest set of muscles in your body to increase the energy burning capacity of your body. If you find this easy, try not to sit, but just touch the chair and get back up.
That's the end of that. And you want to talk about the apps? I'm sorry, my apologies, the slides were not in order. Oh, there you go.
Also, I think Ajoy had mentioned when he was talking about meditation, some of the apps that are thankfully free now in the pandemic, they've made them more accessible for everyone. So we personally use the Simple Habit app, and I recommend that to my patients a lot. It's good for someone that even like me that has some attention issues, really keeps you on, able to focus on the meditation and improves your practice with each session. So I think it's very good. And then I have other patients and friends that use Headspace, and then there's Muse as well. So all three of those are excellent choices for meditation. This is something that I personally, again, recommend, but have used myself. I was never a runner until recently. I always aspired to be one. So I actually used not this particular app, but there's many of them. It's called Couch to 5K. And again, this is more applicable, I guess, when you're able to actually be outside. But it takes you initially about 15 to 20 minutes at a time, and then up to a full 5K, which for some people, it's usually between 30 minutes and up to an hour. But anyway, so you start with just walking, and then you jog for 15 seconds, you go back to walking, and it coaches you through that. So that's a great way to get your cardiovascular endurance up in a guided manner. And I think that's the last one, right? Oh, sorry. And one more thing, for my Fitness Pal, which maybe if you look at our website, you can look at some of our nutritional information that we like to share. So you can track your nutrition on MyFitnessPal, but you can also track your exercise as well. So you can look at, a summary of the week. Oh, I didn't exercise for 3 days in a row. Maybe today's a good day to add in just a 5-minute exercise to help my positivity, to help increase my mood. So that's a good way to track things, also free. So.
Okay. Oops. You don't want to see that again.
And then, also, we mentioned about, if you need someone beyond friends and family, or if you or someone you love is really in a difficult place, as we've seen recently, unfortunately that can happen even with famous people. Here are some local phone numbers that you can reach out to. Many of them are anonymous. We have numbers like this in the US as well. And I've shared them with my patients and called them for my patients before. So I can tell you that they work and they're excellent, and no one will ever make you feel ashamed for calling. And that's, I think, what's most important to realize about this sort of thing. And then finally, our own personal WhatsApp numbers. We are always here. We're always wanting to help. That's what we do. And again, in terms of feeling, should never feel like you're bothering us. We're always awake anyway, because we have 2 little kids, but we're always happy to help, and our phones are always on. And that's just our website, if you want more information.
I think that's pretty much it as far as our stuff is concerned. We stop sharing this. Okay, we're back. So that's pretty much the information that we wanted to share. And like I said, I'm glad that GSB Sabha is recording this, so that will be available on Facebook and wherever else you would be putting it. we ourselves will make sure that the slideshow is available on our website also, along with those numbers. Yeah, I think other than saying thank you so much for hosting us, if there are any questions or something, we'd be more than happy to answer.
Yeah, hi. Yeah, this is Beena here. Can you hear me?
Yeah.
Okay.
Yes.
So that was really very concise and very to the point kind of a presentation, but I think it covered most of the aspects of trying to stay positive. Very well explained. Thank you, the two doctors that are here with us. And I think we can take a few questions. I think one or two have already come into the chats. So I'll try and moderate the questions. If anybody wants to ask personally, you can put on your videos and raise your hand so that we can see you and we can unmute you to ask the questions. But until then, I'll take the ones that have come in the chat. I hope I'm perfectly audible.
Yes.
So there is a question from Deepak Adige. He says, isn't positivity also inborn? Some are sunny and positive, whatever be the situation, and others are always negative. So I think this question is, how do we handle the negative?
I think.
Yeah, that's absolutely true. I think some people, myself included, have to work harder to be more positive. You can use the proverbial glass half empty, half full. I'm definitely more half empty. Joy is more of a half full. So I guess that's good. We balance each other out. But I've found that many of these techniques that we talked about have worked for me. And I think over time I've been, more of a positive person. So it can be done. It just takes a little more effort. And you really have to find what works better for you. Is it the music? Is it the exercise, reading? It's very individualized, but it's definitely, I can tell you personally, do that, even if you're a negative person.
Thank you.
Okay, thank you for that. There's another question from Lakshmikant Prabhu. He says, just yesterday, the Indian authorities cleared Glenmark to manufacture and sell the oral antiviral favipiravir. So what is your take on that?
So I think there are the studies. This is just my personal take on it. The studies are not that conclusive. However, the problem is that right now the urgency in somehow or the other stomping this down has superseded a lot of the traditional ways in which we have been doing clinical trials. So that's why you see the hydroxyquinone hydroxyquinone also being ramped up, saying let's just try to use it, but cautiously. So there when something does not work, physicians have been a lot more cautious in pulling it back. So for example, in this case also, that's what might land up happening. In case something is not working on a case-by-case basis, the doctors that are treating patients, they will pull it back. So I think they've given a lot more freedom for physicians in the ICUs to really think about whether this is going to work. Is it working? Not working? Like taking a very close look at it. So traditionally, it's been like, okay, we know this clinical trial has given us good results. Go forth and use it. This time it is, we kind of know that this is giving us fairly okay results. You may want to try it, but be very cautious. Is the unwritten rule here. So things are changing, but I think just for the benefit of humanity, I guess people are thinking in those terms, saying, okay, let's give the physician some leeway in doing what they want to do. So what do you think?
Yeah, I mean, it's not standardized, and there's no protocols, unfortunately, for this virus. So kind of pulling out all stops. Anything that has helped even one patient, we're using it on especially the critically ill patients. I have friends that are doing that, and we have seen benefit from that particular drug. So why not try it? And I don't recall seeing any significant poor outcomes other than the actual virus taking over. So that's why, why not? If it can help one person, hopefully it can help others.
So you think there isn't enough time for us to check for side effects and things like that, so it's a little too early in the day.
Yeah, exactly.
Okay. Cool. Another question from Mohini Hegde. She wants to know how much time do you think we should listen to music in a day? Is there an optimum time limit
You
to
cannot ask us because our music starts as soon as this is done. The music will start, and it will go on till nighttime. But that does not mean everybody should do this. It's a reasonable. So if you're putting headphones on, we typically would recommend like maybe 15-20 minutes, maybe 2-3 songs, or if it's a classical piece, just listen to the entire classical piece. Half an hour, 45 minutes. It'll really calm you down. So that's
at least 15.
Yeah, at least 15.
But probably 30 to 45 is the best time to get the most benefit, I think.
There are two questions, one from Kiki Petriti Prabhu and one from Anjali Dange. So I'm combining the two because they both are on similar lines. And that is about the kids, since they are all stuck at home and schools are closed. I think the young mothers are finding it very difficult in dealing with children's emotions. So the questions are, how do you advise we keep them engaged with less screen time? And also Anjali says that her son is continuously asking about when can his friends start coming home. So and the answer is uncertain right now, and he gets very upset when you don't have a definite answer. That's how children are. So your take on that, Jenny? I think
so we definitely have seen that in our 7-year-old. He's a very emotionally mature child, which is usually good, but in this case, maybe not for him. So either way, in pediatrics, we always talk about being very honest with your kids. So, trying to take it to their level, but if they're asking questions, try not to keep things from them. It's best that they know what's going on. So we explained to, his name is Akash, we explained to Akash, why we can't go out and meet friends in simplistic terms. And, we're trying to protect other people. We're trying to protect ourselves. And, if we keep reiterating that, he seems to understand. For socializing, he has been, basically having FaceTime or WhatsApp time with his cousins and friends from school and that sort of thing. And that's been helping. He did, I don't know if you're familiar, there's a game called Battleship. He plays that with one of his friends that you can come up with games that can be done virtually. And that really will take up a couple hours of his time. And we say, okay, if you finish your schoolwork, then you can meet his friend Manny later on and, play this game. So you kind of set goals for that day. If you attain that goal, then you can have fun time with your friends. We try to be creative. Like Ajoy mentioned, something new that he hasn't tried yet, a new hobby. Like we've been teaching him chess. He helps me bake. Something that you wouldn't necessarily do with your kids, maybe start introducing it to them at an earlier time. He's also been, since we're moving to India, he's been trying to start to learn Hindi on Duolingo, which is a free language app. So just new things for kids. Anything new is usually exciting for them, more so than adults. So introducing them to new things and new creative things. What other part of the question that I might have forgotten in my rambling? Was there another part?
How do you reduce their screen time? And there's another question in regards with this, wherein some of the schools have started online classes for 5 and 6-year-olds. So is that a good thing to do? So there's another question on similar lines. Yeah.
So I'm in mixed minds about that. I think it depends on the child. At that age, there's a huge range of of abilities in children. Like we're lucky that Akash has a good attention span and could pay attention, but I have patients that can't sit still for their 5-minute exam when I see them in the office. So there's a huge range of kids. So unfortunately, fortunately, the kids that can benefit from it will do fine, but the ones that can't sit still are probably not going to get much out of a live class. Now, what Akash's school is planning to do, I believe, and what his current school is doing is giving 2 pages of work to do per day. And he's in first grade. And I think that's more feasible. So what we do is we break it up. He does math in the morning, and we give him a break, let him read a book or play a game. And then later on in the day, he does his second round of work. So he knows he has to do it, but we break up the day. And I think that's better, in my opinion, than a live class at that age. I would say probably live classes shouldn't be mandated until at least 4th grade. So, 9 or 10-year-olds could probably do it, but little kids, that's just, I think, too much to ask. But I still think they need the work, just it should be at their own pace. And I understand that is challenging. I also, I am not a teacher. My mom was a teacher, and I have utmost respect for teachers. I think most parents do after the last couple months. We are learning ourselves how to be patient with our children. So yeah, and in terms of screen time, I also, if you look at the strict guidelines from American Academy of Pediatrics, it's 2 hours per day. I think all of us have been a little more lax with that lately. I think the AAP would understand as well. But what my rationalization is, if he's doing screen time, I try to make it educational. So like I said, he's, trying to learn Hindi. He's actually teaching his little brother the ABCs with, Sesame Street Elmo and that sort of thing. So we try to make it a little better, but, good thing is there's lots of YouTube video. Oh, that's actually one thing. Again, this is a video, but you can look up, what was I going to say? That like the Cincinnati Zoo has, I think it's like a 30-minute talk. There's like probably 20 or 30 of them on a specific animal every day. And it's, it's great. Our kids have loved that. There's also like drawing tutorials and things like that. So, there's good parts of screen time also.
One thing I'd like to add is that we believe in lead by example. So we should not be sitting on our phone and saying, hey, stop doing your iPad or whatever. So we purposely, when we are telling our child or both our kids now that they should not be on screen time, we don't have a phone or laptop in our hand. We just, we're doing something else and we turn around and say, don't do this. That's, I think you've exceeded your time or something. However, I also have to say, like Jenny said, these days we have to be a little bit more lax in terms of our strict adherence to, it has to be 2 hours and you're done. You have to consider the child's, immediate environment. What is the child supposed to do? I mean, maybe some more physical activities, but yeah.
And if you're able, getting them outside is huge. We found that for our kids. Like, luckily here in Puerto Rico, you are able to be outside within a certain time period. I know in some parts of India, you can't even go outside. Actually, most of India.
Mumbai, I don't know, depends on.
But here, even if you have a balcony for the kids, just getting them to that fresh air, they stop fighting with each other less. They look at the birds. It's just much better. So even if you can stick their head out the window, that's probably gonna, be super beneficial for them.
Yeah, thank you for that. And that was as far as the kids were concerned, but there's a question on the other side of the spectrum, which is about the senior citizens. So Pratima Pai has a question about, how do we pep up senior citizens, especially if they are technologically challenged. You can't expect them to, be on their, engage themselves. And with the fear of infection still prevalent, they are homebound and, aggravating the isolation. So your take on that, doctors?
Yeah, so I have, I've been doing telemedicine from here, and a lot of my patients are my US patients at least are elderly and are stuck at home. So they're in that situation. And, I actually, with them, I don't even do the video appointment. I call them because they're not as technologically advanced, I guess, as me, which I wouldn't say is very, but anyway, so I talk to them on the phone. And so with them, it's more impressing upon them to work on their hobbies, because a lot of them, they've been around for longer and they have more hobbies. Most times I found that my senior patients have more hobbies than we do, because they were there before technology. So a lot of them have been sewing more, knitting more, doing puzzles. You know, a lot of them proudly tell me how many puzzles they've completed in the past couple months. Having phone conversations with family is important. You know, maybe set an alarm to remind yourself to call your parents, to call your grandparents, because they get a lot more benefit out of it probably than we do, just hearing your voice. If possible, again, this depends on where you live, but if you can even go drive to their house and wave to them and, you know, talk through the window, that, you know, we were doing that at the beginning of the pandemic with friends, just driving by and waving to them, or like talking to them from at least 6 feet away through a window. That's something that you could do that would really help them out. I think
a lot of the slides that we put up, we were actively keeping the elders in mind with those slides. That's the reason why we mentioned things like, you know, actively doing bhajan, actively, you know, trying to, you know, do some hobby. And these are not like screen time kind of things. These are like things that you can physically do. Reading, you know, Gita or whatever they feel that they can read. And having conversations with people over the phone. So I think those are the kind of things. And of course, you know, if, you know, kind of probe them to see if they were inclined towards a hobby and ask them to kind of, you know, rejuvenate that would be a good thing too.
And providing them with the resources if they
Yes.
need it. Like if they, you know, they need more yarn for knitting or something, you can drop it off, have it delivered to their house or something. So, you know, if they say, oh, I don't have that book, have them get a new book, you can, you know, have it sent to them, that sort of thing. That's what my patients have been saying their family's been doing for them, which has been helpful.
Yeah, because I have my dad also who's almost 88, you know, so we can see that it's getting a bit frustrating now, you know, with them being at home since I think end of March now, you know, so it's a tough call for the elders actually. There's another question from Lakshmikant saying that has social distancing actually helped in this scenario, or it's just, you know, what's your take on social distancing?
So this is the epidemiologist speaking here. It has. Short answer is it has. It's the number. So the number of cases, the number of casualties because of COVID, the total number would have been the same whether you do social distancing or not. This may sound really strange, but it may be the same whether you do social distancing or not. The difference is the time that it takes for all these casualties to occur or cases to occur and complications to occur. Actually, take that back. Maybe a little bit less because, first of all, when you have social distancing, you've actually given healthcare workers and hospitals some time to, you know, they have 1,000 beds, you know, you cannot have 10,000 people coming in there. So that aspect is primary. Preparation, you know, and, you know, being prepared for, you know, for this kind of a thing was, you know, nobody was anticipating this. So in terms of resource usage has been better. Okay. The second part, which, you know, which happens because of the fact that time has gone by, two other things that happen because the time has gone by. One is more and more people are asymptomatic and have become immune, but they don't even realize that they become immune because we are not doing antibody testing on these people. So there may be people walking around or, you know, in their homes because they just went to a grocery store, picked up the infection, brought it home. Everybody in the home has now got the infection, but they are asymptomatic and they are perfectly fine. So that means they will not get this infection, right? So that's the other thing that has happened. And the third part, which I feel coming from this is my research background speaking, is gives us scientists time to work on vaccines, time to work on new drugs. Yeah. Maybe in July, there may be some breakthrough that, like right now, we're already talking about a vaccine. Now, when I was at the NIH, I have to make some small correction. I quit NIH days before this COVID thing happened. So when I was at NIH, it would take us typically 18 months. 18 months was minimum to develop a vaccine. Now, you know, we're talking about, you know, that's Moderna is saying, oh, we'll have a vaccine in another few months' time. I don't know how efficacious it would be, but the point is that people are putting in so much resources into trying to, come up with a vaccine. So these three things are definitely because of social distancing. So there are benefits now. The downside is, yes, the economy is suffering, but I'd much rather say that, people are living than, what's the point of an economy when, there's huge casualties. So that's my personal take on it.
Yeah, I mean, unfortunately, you can see the numbers in the US starting to creep back up as social distancing has been not removed, I guess, lessened. You can see that. I was just looking at numbers yesterday. You can see the numbers go down, and now they're starting to creep back up again slowly. Probably won't be as bad as initially because of the initial social distancing. But even in micro areas, like in the hospital that I worked at in the US, once they started the shelter at home order, our ICU was overflowing, and they were calling other doctors in to help in the ICU. And as soon as that shelter in place took effect, every day the numbers started coming down. So it definitely absolutely helped. And the key is really just giving healthcare providers and research scientists time to make protocols, time to make treatments. Now that that's happened, yes, the numbers will go back up, but now we can handle it.
One other thing I want to mention at this point, which is I feel very strongly about this because I've seen a lot of my, patients, especially in India, friends and family also saying these things that, it's disaster time in India versus other countries and stuff like that. And I'm going to go out on a limb on this, and I'll say this. Somehow, I'm not sure exactly why, maybe because of heightened immunity or because of the environment or whatever, the overall death rate, even if it's been misreported, is almost a log scale better than some of the other countries, right? Considering the population. So please, if you can take anything away from this question, from my perspective, is that, in India, you are in a much better position as far as death rates are concerned than many, many, many other countries. So I don't know what it is. I still have not been able to figure out BCG, heat, the environment. I'm not sure, but there is something that is like
something to be positive about, right?
So in continuation to that, Bharat Kini wants to know, has Corona peaked, or is it going, I'm adding to that, or is it going to be an up-down kind of a scenario? It'll come down and then it'll go up.
It might go back up, like Jenny said, but it may not go back as bad as, what happened in the 1918 pandemic and things like that, because we are much more informed about medicine. We are much more informed about how to keep ourselves safe. 2 people wearing masks drops the numbers down to like negligible levels of cross-contaminating each other or infecting the other person. So, and of course, another 3% or 5% comes from washing hands and so on, but 95% of it is masking. What is it called? Mucosal contamination.
So the worst is over. You think the worst is over? You think so?
For which, so for US, I think worse is probably over. India, it's getting there. I've been watching the death rates on a daily basis. And, except for that one spike of 2,000 that just happened like 4 or 5 days ago because of calculation issues, the numbers are still going up. I mean, they're like,
we think it's peaking now.
It's probably
and
peaking
so
now.
It'll probably stay high for I don't know, another week or something, and then go down. And I think there'll be more peaks, but not as high. And we're hoping this is the highest peak.
Okay.
And now there might be more, especially with festivals and maybe monsoon. But I think this is probably the highest peak, and it should get better from now.
Yes. Hopefully we'll see smaller hills on the graph soon. So there is a question from Ashok Prabhu. He wants to know about the effective time for meditation. Is it a dawn, or it can be done at any time of the day?
I mean, it can be done anytime. Anything that you do is beneficial. We typically find that, we should do it during dawn because it's, you're refreshed, your body is refreshed. However, for practical reasons, we don't do it at dawn. We typically do it, in the evening. Even though the kids are running around and all, that's one of the reasons why we use the meditation app rather than just sitting by ourselves. Because when we're sitting by ourselves and the house is full of other people, invariably, there is distraction, and it's a little harder to move back into your mantra or whatever. So dawn would be the best because everything is quiet. Your body is just about woken up. So it would be the best. But for practical reasons, doing is better than not doing it.
I think it's individual, whatever works for you. So if dawn might be, I guess, physically the best time, but if you're going to be stressed about making it to work in time or cooking for your family or getting your children ready, then that's probably not the best time. So, if evening is more practical, then that's when your body will get the most benefit out of it. So it's really individual.
I think so, yeah. What works best, right? So there's a question from Uday Malya. Now this is about many people eat more when they are under stress, which can lead to other problems. So what could be your take on this? Also, I think being homebound also has increased food intake with a lot of people. So what is your take on that?
Tell them what you think.
Oh gosh, I could go on forever.
Especially if baking is one of the hobbies, then
Yes, baking is unfortunately one of my hobbies. It's a genetic thing. My mom was the same way. No, I've heard this from actually, again, this is a big topic in friends and with my patients too. It's hard because also accessing fresh fruits and vegetables is harder now too because of the pandemic, and that, if you have to eat, I'd rather you eat that. But again, logistic wise, that's not possible. One thing you could consider doing, which is what I've been doing, and which is, I'll probably do a talk on this because it's my latest, is something called intermittent fasting. And I know many of us know what fasting is, but there's a specific, method, thank you, of intermittent fasting for certain hours. So that's how I do it, because I'm a snacker, I'm a grazer. And if I can't discipline myself, I would eat all day long and just out of boredom. And I understand a lot of people are probably the same way as me. So if I tell myself I'm not going to start eating until 2 p.m., but I'm going to have water, I'm going to have plain tea, I'm going to have black coffee, I'm going to have some vegetable broth until that time to keep me satiated, then that, I have that cutoff time. And in the meantime, keep myself busy with, I've now perfected the art of cooking without tasting things, which has not been easy, but my mother-in-law used to do that. So I take her example. Anyway, yeah. So what I have to do is I have to set a cutoff time. I'm not going to eat until that time. And if I can reach that goal, then I can allow myself to, partake of some food. And also when you open up your time to eat, you have to be careful about not overeating at that point. But it's, that's one opportunity you could use to use that MyFitnessPal app that we were talking about, where you can record everything you eat. Recording what you eat in medicine is really important. It's a part of, being more self-aware of how much you're putting into your body. You hold yourself accountable. If I'm going to eat that bowl of rice, what I used to do and what I still do is I'll look it up on MyFitnessPal. Oh my gosh, one bowl of rice is 270 calories. Do I really want to put that much into my body? And you don't have to say I'm only eating 1,600 calories, but you can at least see how many calories are in one particular portion, and it might evade you from having that much or having a smaller amount. Another method is, and we use this more at restaurants, if, especially in the US, they give you huge portions at restaurants. So what a lot of times we'll do is we'll divide it in half, ask the waiter to take away the other half and pack it, and you can eat it for lunch the next day. So out of sight, out of mind is big for me, at least. Ajoy has a lot more discipline. For me, I need it out of sight, out of mind.
So we'll need hours and hours to discuss this particular aspect. But one key element that I want to present to you all is eat calorie poor food. I repeat, calorie poor food, not calorie dense food. So in other words, the densest is oil. Next dense is probably like meats and eggs and things like that. And as you go poorer and poorer in terms of calories, you'll come to green leafy vegetables, root vegetables, even rice is poorer, lentils, dals. Eat that, and nuts are also fine. So even though nuts are, that's an exception because it's calorie rich, but still, I mean, you eat small amounts, it's okay. But if you eat calorie poor food, what ends up happening is you are eating a lot. So I mean, every day the amount of food that she and I eat is a fair bit, like in terms of volume. But if you look at the total number of energy that we're getting from that food is very minimal. And that's what is needed in this day and age, because we are not doing much physical activity. So whatever we are taking in is going straight to becoming fat, becoming fat tissue in our body. So you want to avoid that. I mean, exercise will not get rid of that. It will only help your body burn and become metabolically enriched, and that's how you will actually get rid of the fat. It's not like running actually will help you reduce weight or something, or doing
it does minimally,
very, very minimally. Main thing is that you eat calorie poor food. When I purposely say calorie poor food, even though they're actually very, very, very nutritious, green leafy vegetables, fruits, lentils, they are very, very, very nutritious, but their so-called calories in terms of calories is less. So if you substitute a lot of the packaged foods with this, it would help. Another thing I would highly recommend, and it's harder these days, is not to bring home anything that opens in a bag. So in other words, like chips and things like that. You open kodbala and this is not the time for all those things. Later on when we go, once this thing goes away, then you can bring chakuli and karbala and all. If you make it, also try to eat less of the fried stuff. That's one of the issues with, at least especially in our community, as you all know.
But also don't completely deny yourself either, because then you'll crave for it and then you'll binge on it. So, say on Friday evening, we can have our chips or something. Allow yourself a small amount once or twice a week. That's what I tell people.
Yes. But unfortunately, statistics show that the sale of packaged food has been highest in the lockdown, So
yes.
I'm thinking people
which is
are.
Understandable why. Yeah. We should try to avoid it, but
So
it is understandable.
Yeah. Jenny, I look forward to eating GSB food once you're in Bombay.
Sorry, you broke up. What did you say?
I wanted to ask Jenny if she was looking forward to having some nice GSB food once you come back to India.
Oh yeah,
Konkani food.
Oh, very much. I mean, luckily we have good friends here that have provided me with some desi spices, but Puerto Ricans, I guess, don't eat a lot of spices. So it's been a challenge. Yeah. My kids love pala and dalitoy, which we've somehow managed to make various versions of using a blender and the kind of limited dals that they have here. But we're making it work, because my little one has to have pala every day, otherwise he won't eat breakfast. So so we're making it here, but I can't wait to have all the fresh fruits and vegetables and good spices, not sad spices that we have here. And also getting my ragara back, which I miss.
So there are a lot of people saying on the chat that it was a fabulous session. So that brings me to the last question on the chats, which is from Ashok Prabhu. He wants to know, what's your take on herd immunity and homeopathic medicines?
Herd immunity is absolutely is a thing. Typically, we look at numbers kind of high. We need like about 70% people immune before the rest 30% can be protected. That's the number that we look at it from an epidemiologist standpoint. So 70% of the people should have immunity, and then the 30% can be protected. So what I'm hoping is that all of us, maybe in our age group, get protected. So, I mean, get immunity so that the elders can be protected from this disease. I think is up. So that's one. As far as homeopathy is concerned, I know that there's a strong belief in homeopathy. Unfortunately, we are absolutely not the experts in it. So you can ask us about allopathy, you can ask us about holistic medicine, you can ask us about a little bit of Ayurveda, but homeopathy is something that we have not practiced ourselves. We would like to find out more about it, but we should not be talking about anything that we don't know much about. So yeah, I mean, I personally, when I was a kid, I've taken homeopathy. I don't know if it has worked or not. I'm sure in many cases it has worked because there is some scientific body of evidence behind it. However, since we have not practiced, I don't want to comment on it.
Right. Yeah. So that takes care of all the questions on the chat. So if anybody wants to personally ask any questions, now would be the time, or else I think you can raise your hand if anyone wants to ask a question. If your videos are on, I can see. If you can see that. Yeah, I think that's about it. So a wonderful session. I'll request Uday Malya, the GSB Sabha treasurer, and a very old hand at the Sabha who's been since, I always say he's been here since 1934. So that's the time when Sabha was established. So one of the old volunteers of the Sabha. So he introduced you. So I'll request him to also thank you for this session, Ajoy and Jenny. Yeah, over to you, Uday. Pandu, you need to unmute him, I think. Can you unmute yourself, Uday? Pandurang, can you unmute Uday?
Oh, uh-oh.
I think. I think try it, Uday. Try to unmute yourself. Pandurang, can you unmute Uday, please? Pandurang, can you unmute Uday, please?
There,
Okay,
you got it.
sorry. So here I am. So I think Veena just mentioned that I'm there from 1934. So it took that much more time for me to come and do this vote of thanks, you know. So well, on behalf of the Sabha, thank you very much to the Dr. couple, Dr. Ajoy Prabhu, Dr. Jennifer Prabhu, for taking this topic in all the aspects and then for patiently answering all the questions. We had told you that it's going to be a 1 hour session. I think we are close to 1.5 hours now, but you did not show any fatigue, and you patiently took up all the questions as they came. So thank you very much, both of you, for that. We really look forward to, oh, here's the baby also. So we really look forward to welcoming all of you whenever you are in Mumbai, so that we can have a physical meeting than a virtual meeting that we have had now. We would like to listen to you in person. We would like to have you in a function where we have all the GSB delicacies like the Gaj Baje and the Hotto and the Adgai and all that. So we would love to do that maybe at an early date. So thank you once again for the time that you have given to GSB Sabha today. And thank you to the wonderful audience who have also enhanced, I think, this session by asking some very, very relevant questions. So thank you to the audience. We connect again on the next Samvad series, which will be on the 28th of June, that is next Sunday, at the same time, 4:30 p.m. We will be giving you the details of the session shortly over social media. With that, I think we are at the end of today's session. So thank you once again, Dr. Joy Prabhu, Dr. Jennifer Prabhu. Thanks a lot, and namaste to both of you.
Namaste. Thank you.
Thank you.
Thanks.
Thank you so much.
Bye.
Thank you.
Bye-bye.